Good evening. Good evening, all. Welcome, welcome. Good evening. Welcome to the National Baptist USA Incorporated. Welcome this evening to our NBC USA Hope Health webinar. Temple Care Matters. We trust and feel and trust that everyone has had a great evening and a great week so far. We'd like to acknowledge our national president, Dr. Boise Kimber. We also give a shout out to our National Hope Director, Dr. Michael O'Miner. Tonight, Hope's monthly webinar overview will be tonight's overview. Join us this evening as we reflect, uplift, and prepare our churches for our meaningful engagement of October and beyond. This month focus center on safety, healing, and hope. One, we're going to look at the National Church Safety and Security for the month, exploring practical, strategic to protect our congregants physically, emotionally, and spiritually from emergency planning to mental health awareness. We all share tools to help our church create safe and welcome spaces. We'll also talk about pregnancy and infancy loss, a sacred time to honor grief, offer comfort, and support families who experience a time of loss. We share these ideas for remembrance services, pastoral care, and community outreach that reflects compassion and faith. We're going to also talk about NBC USA Sisters Against Breast Cancer campaign. We're going to talk about updates about what our NBC USA churches are doing nationwide as they activate the toolkits, host walk and run events, and honor survivors. Let's celebrate the creativities and commitment of the sisters, leaders, and volunteers. And we're also going to talk about diabetes awareness. That will be for in November of 2026. We're going to get a first-hand look at our upcoming campaign focused on prevention, education, and support for those living with diabetes. We'll highlight resources for healthy eating, faith-based communities, and family engagement. Let's continue building a legacy of health, healing, and hope, one church, one family, one step at a time. This webinar is part of the continuous series of the first Tuesday TempleCare Matters. Now it's time for our triple-demic update: COVID, RSV, and flu. What to know about the Stratus variant. As we continue to prioritize health and safety in our congregations, it is important to stay informed about the emergent COVID variant. The latest strand, known as Stratus, is now the dominant variant in the U.S. and in part of the Omicron family. While it doesn't appear to cause more severe illness, it is spreading rapidly and may be more adept at evading immunity from past infections or vaccinations. Some of the common symptoms of Stratus include a sore throat, respiratory or congestive or runny nose, a cough, fatigue, headache, fever, or chills. These symptoms mirror those of the early Omicron variant, but experts note that the loss of taste and smell is less common. Stratus is especially preventable among those. Stratus is especially prevalent among those who had not received the updated COVID vaccinations. Health officials continue to recommend staying up to date with your COVID vaccines and boosters, especially for seniors and all those with underlying conditions. Practice good hygiene and masking in crowds and indoor settings. Monitor symptoms and testing when needed. As faith communities gather this fall, let's remain vigilant and compassionate, especially toward the vulnerable members of our churches, families, and communities. Churches are encouraged to share accurate information, support vaccination efforts, and create a safe worship environment. Now, for this month's featured observation. October is Pregnancy and Infant Loss Awareness. We know the joys of families as they celebrate a pregnancy. Then we experience the pain associated with the loss of the pregnancy or the baby of 1 year or younger. This evening, we'll have a wide reach discussion about the vital issues. We are fortunate to have our guest panelist this evening, Dr. Karis Bauer. She is the distinguished physician specialized in neonatology prenatal medicine, currently an associate professor at the University of Tennessee Health Science Department, a pediatric division of neonatology in Memphis, Tennessee. She holds a dual board certification from American Board of Pediatrics in general pediatrician and neonatology, reflecting her expertise in critical care for newborns. Dr. Bauer earned her Bachelor of Science in Biology from the University of Alabama in 2010. Roll Tide. Followed by her Doctorate of Medicine from Ohio Medical College in 2014. When difficult times arise at work, she reflects on her medical school mission, worship of God through service to mankind, to remember what is important and to see the mission through. Her clinical training includes pediatric residency at the University of Tennessee Health Science Center, Memphis, and a perinatology medicine fellowship at the University of Texas Health Science Center in Houston. She is licensed by the Tennessee Medical Examiner Board, serves in both academic and clinical roles as she cares for sick newborn infants and mentoring future pediatricians. As a physician leader, she's made it a purpose to educate and empower others toward community, equity, and generosity by exemplifying these same values at work and at home. Welcome, Dr. Bauer.
Thank you. Thank you, Sister Carr, for that introduction. So happy to be here with you all. I'm glad I tricked you to say Roll Tide.
I know someone in the background is not happy about this. Dr. Bauer, let's begin this evening discussion by understanding the challenges of pregnancy and infant loss. First, what are the current statistics on preterm birth and infant mortality nationally?
Yes, I have a slide to share with you all. I'm going to share my screen here. Let's see. And so before I do talk more about the statistics around preterm birth and infant mortalities, I did want to just highlight a couple of definitions when we're looking at these numbers. Preterm birth, as it is defined, is a birth that's prior to 37 weeks of pregnancy. And infant mortality defines the loss of an infant before their first birthday. And so I just wanted to keep that in mind as we look at these numbers. In the US, the preterm birth rate in 2023, the most recent numbers that we have from the CDC is that 10.4% of all live births in the United States were prior to term. And nationally, 5.6 or almost 6 babies for every 1,000 babies who are born die prior to their first birthday. And that equates to 20,000 babies lost a year.
Wow.
What is most disappointing to me, though, is that there exist these racial and ethnic differences in preterm births and infant mortalities, which we'll talk about. In 2022, preterm birth rates among Black women was about almost 15%, which was almost double that of white counterparts and significantly higher than Hispanic women. And to give another idea, the United States, where we land compared to other European countries, for the almost 20 years plus, we've consistently ranked lower than what is referred to as other developed countries. The United States remains one of the most dangerous places for women in childbirth, and for infants. Preterm births represent one of the top 3 reasons for infant deaths prior to 1 year of age, usually either the second or third leading cause. And then when we look at it regionally, these are some things that I really wanted to highlight. As a pediatrician and a neonatologist, these things really worry and concern me, and it's becoming more prevalent to the public's attention. In Mississippi alone, almost 9 infants out of every 1,000 live births die prior to 1 year of age. That number jumps to 15 infants out of 1,000 live births when we look specifically at Black or African American population. And that Mississippi has the worst infant mortality rate in our country. And that is compared to New Hampshire, where 3 infants or 3 children may die before 1 year of age. This made national news recently. I have a video that I want to share with you all.
We turn now to a growing health crisis. Mississippi has declared a public health emergency over the state's rising infant mortality rate, which last year reached the highest level since 2013. CBS News medical contributor Dr. Celine Gounder joins me now. So, Dr. Gounder, what's behind this crisis?
It's a combination of healthcare access as well as various different social challenges. So more than half of the counties in Mississippi don't have a single hospital with a labor and delivery ward or an OBGYN to deliver a baby. That means that women have to travel that much farther to access care. Poverty is also a really big factor in Mississippi. Nearly 1 in 5 people in Mississippi live in poverty or below the poverty line. And Black babies in particular in the state are dying at twice the rate of white babies, which shows that some of these healthcare disparities continue to play a role in the state.
And what's the state doing about this now that this emergency has been declared?
Well, one of the things they're doing is trying to expand prenatal services in areas that don't have the obstetric care. So they're setting up a statewide system to make sure that people are transferred promptly to the hospitals with the right level of care, and also trying to institute home visiting programs to help women ahead of pregnancy manage their health issues.
Right, because of those long distances, you don't get the checkups along the way. That makes the ultimate pregnancy that much more challenging. So what other kinds of things could a state facing these kinds of challenges do to make the situation better?
Well, the biggest predictor of maternal issues, whether it's her own health or the baby's health, is what was her health going into the pregnancy. And what is the best way to manage your health going into a pregnancy? It's to have access to health care ahead of time, right? And when you're talking about a state where 6 in 10 births are covered by Medicaid, you have an extremely significant proportion of the population that's below the poverty line, not waiting until somebody gets pregnant to start them on health insurance, but having health insurance, Medicaid ahead of time, where you can start to address your issues, high blood pressure, diabetes, obesity, et cetera. That's what would make the biggest difference.
All right. Let's see. And so, as she mentioned in that video, one of the reasons for such poor health outcomes simply lies in, not simply, but it's a complicated problem, but what was mom's access to healthcare prior to the pregnancy? This is a chart that more so represents outcomes in Tennessee, the state in which I practice. I also actually care for babies in the Mississippi area. We also care for babies in the Arkansas, kind of the tri-state area. And I know that we have people joining us from across the country. Going further along with preterm births, it kind of follows a similar pattern. There is an alarmingly high rate of preterm births within the state of Mississippi. 15% of all live births in Mississippi in 2023 were preterm deliveries. That's in comparison to just 8% in Vermont. And just to answer your question about some of the statistics.
Yes, Doctor. these statistics are just staggering. It just alarming. What are
Yeah.
some of the most common causes of premature birth or birth defects with these numbers being so high, especially in the state of Mississippi?
Yes. So the causes are varied. Um, we, are still fully understanding specific causes, but more so the risk factors that place women at higher risk for having preterm deliveries, and by preterm deliveries, um, higher risk of infant mortality is really something for us, to talk about. Um, and I want to point out that there are groups or demographics who have higher risk of preterm delivery. It doesn't necessarily point to causation, it's more of an association when we look at statistics. So the demographics that do see higher rates of preterm delivery include teens, women who are advanced maternal age or above 35 years of age, Black women, Native American, Native Hawaiian, and Pacific Islander women, American Indian and Alaska Native women, women who have lower incomes, who are experiencing stress or chronic stress, women who have chronic illnesses such as high blood pressure or diabetes prior to birth, women who have had a prior preterm birth, and also women who use tobacco or drugs. I think we are aware of that, but again, want to highlight that these are associations and not necessarily clear causation.
Okay.
Yeah.
We know that when pregnant women lives or newborn goes home goes home is the same. How do social determinants like access to care, housing, education impact infants' health outcome?
Yes. If a healthy baby, it starts with a healthy pregnancy, and a healthy pregnancy starts prior to the pregnancy. It starts with mom being healthy and having access to healthcare, access to food, access to shelter. And when those things are not in place, it clearly is associated with poor infant outcomes.
Wow. Wow. Now let's discuss about faith meets medicine.
Mhm.
Dr. Barrow, how does your faith influence your work in neonatology and perinatology?
Yes, it's everything. My faith is where I draw strength to do my job.
Okay.
There are times when it's very chaotic in the NICU, especially when we're working to stabilize a baby, and there are times where I have to lead resuscitations to stabilize the baby. And most times I'm quietly praying to myself for just clarity and calm in the middle of all of that. So that, you know, we can do what we need to do for the baby. And then even in hard times when we've done everything that we can, and we do lose a patient or a patient dies, those are the times that I have to really trust God,
Mm-hmm.
trust that there is a bigger plan,
Mm-hmm.
and being okay with not having all of the answers, but knowing that God does. It really permeates everything that I do. I wouldn't be able to do my job and to do it well without Christ.
Amen. Amen. He has a bigger picture, and there's always something that he knows that's better for us or that family.
Yeah.
Speaking of the church, what role can churches and faith-based organizations play in supporting families with premature or medically frail infants?
Yes. So this is such a wonderful opportunity for the church to act in love for these families, especially families that are closely affiliated with the church. Like, one thing I definitely wanted to say for these families is oftentimes we actually don't know the exact cause of why a preterm birth happens. And oftentimes families are dealing with feelings of guilt, confusion. They may even be experiencing a crisis of faith in those times. They're grieving. And it's really important for families in that situation to hear and understand things like it's not your fault. And it's not the place to even play the blame game. They may be playing the blame game with themselves about why their baby is born preterm or why they lost their infant. It's really just an opportunity to act in love. They're dealing with a baby who is experiencing a long hospitalization, a baby who, while in the hospital, may be experiencing multiple acute illnesses. And even after getting out of the hospital, that baby may grow. As they grow, they're experiencing breathing problems, feeding difficulties. Their baby could have cerebral palsy, which is going to affect them for the remainder of their life. They could have vision and hearing problems. And the emotional toll and the financial burden that these families deal with, it's life-changing. And the church has a wonderful opportunity to step in and offer prayer. Prayer is important, and for so many of our families, and in my experience, like their spirituality and their faith really carries them through this difficult experience. On a very practical level, especially if you're in close circle or close relationship with this family, can do things like help them with prepared meals, with home chores, errands, childcare of their other children if you're very close. There are things that church organizations can do, like for the hospitals where these babies are, like don't offer donations, monetary and item donations. But there's just a wonderful opportunity for the village to step in and really support families.
So you're speaking about a church member or a community to come out and just sit in the NICU and hold the baby while mom is at home, or taking care of the kids, or even going to school herself, or just somebody to step in and be there for that infant at that present time while she's taking a few minutes for herself.
Yes, and there are actually volunteer programs through the hospital where you can. There are babies who, for various reasons, their parents can't be in the hospital with them at all times. And we have volunteer programs for people to come in to hold the babies and let the babies know that they're not there alone. As those babies grow, they do know that there are people there and can sense that there are people there. So,
all right. After considering the church, let's talk about the community action and advocacy. What can we do at the community level to help reduce infant mortality? I know it's a lot of things that we can do, but can you give us a few pointers about what we should be doing?
Yes, on a community level, there are community organizations. March of Dimes is a wonderful program. I'm sure a lot of us have heard of this program. It's really, really an awesome program nationally. And then they have local chapters of which you can join and donate your coin and your time. It's I'm personally not a member of our local chapter, but I definitely have links and connects if anyone's interested in March of Dimes. On a community level as well, just being aware of these issues. I'm so excited that you all are having this program like this. Just awareness is the first step to really addressing issues. But just being aware of this issue, being aware of what are our state representatives and our state elected officials, like what are they saying around these issues in our states around infant mortality? Is it something that they're even mentioning or that they have plans to address? And taking that and speaking with your vote, who are the candidates and who will address these issues? And then specific issues are that we should be concerned about is how are we going to allocate funding, state funding, specifically to Medicaid extension and expansion programs? Where do these candidates stand on things like this? Because they have very real effects on mothers.
They sure do.
very real effects. And unfortunately, it is estimated that with the recently passed national budget, millions are going to lose Medicaid coverage. And I don't know what exactly that looks like, but I am concerned that it's gonna worsen our infant outcomes, and the most vulnerable of us are gonna affect the most vulnerable of us.
Wow.
So,
Wow. I know this is a national call, but there are local programs or partnerships that are making a difference in the maternal and infant health. You spoke about March of Dimes as one of those. Are there others besides March of Dimes?
I specifically know of March of Dimes, and again, going to your local children's hospital. They have volunteer programs, and of course, there's screening volunteers and for safety and all of that. But you can directly give of your time, of item donations. Those babies, if you think if you're a knitter, they need hats, they need blankets, prayer cloths and things, like all of those things really matter. They need clothes, socks. And so you really can, as an individual and as a church community, go to a local level for hospital. This is the hospital, 3 or 4 hospitals that takes care of NICU babies.
Okay. Let's look ahead. What innovation or changes in medicine give you hope for the future of neonatology care?
Yeah, I'm most excited that this issue is getting public attention. And these are issues that the medical community has been aware of for decades, but in the most recent years, maternity mortality rates and infant mortality rates has just become more to the forefront of public attention. And that awareness and that attention, hope converts into solutions, people caring about these things. There are success stories when there's action on a state level, when there's organized efforts towards improving these numbers. It happens. Here in Tennessee, we have the Tennessee Infant Health Strategic Plan. And just over the past decade, the infant mortality rate, although it is still appalling, has improved by 10%. And that was as a result of organized effort to improve it. And so those are the things that give me hope and that I'm excited about. I don't, know what exactly the future holds, but I know who holds the future.
All right. Amen. Amen.
Amen.
Amen.
And these were organized efforts around these specific domains that we know can affect infant outcomes. And so I'm most excited about that.
Okay. All right. If you could change one thing in the healthcare system to better support families and infants, what would it be? What would be your biggest wish?
I think there should be universal health care.
All right. All right.
Yeah.
I agree.
Healthcare is a right.
Yes. We have covered so much this evening. Is there anything else you would like to add to this discussion regarding to your passion that you have loved so much?
I just thank you all for caring and just what you're doing here as a church organization is so important. It's important to stay informed about issues. I think that is how a lot of issues go unchecked, is that we don't know about it as a whole, or we don't talk about it as a whole. We don't talk about the problems. And so I'm grateful for you all.
Oh, thank you. Thank you. Thank you so much, Dr. Barr, for being with us this evening. We'll take a couple of questions now to see what is everybody's asking about this amazing topic, but also about health for our little babies and families. Brother Duke or Sister Carper, are there any questions that's out there that we can have Dr. Barr answer for us?
We have viewers watching on Facebook, but no questions have come in yet.
Okay. I have a question, Dr. Brower. I'm in the state of Wisconsin, and you stated that your statistics only looked at Mississippi. Have you ever looked at statistics across the country compared to Mississippi, Tennessee, and Alabama as of today?
Yes, so yeah, that chart sort of represented state by state breakdown. The CDC, as of 2023, has up-to-date statistics on infant preterm births and infant mortality. Actually, yes.
Okay.
And just nationally, again, about 1 in 10 births nationally are preterm births.
All right. All right. And you also stated that in all hospitals are taken across the country except those prayer blankets, knit hats, and such, because I didn't know that they would accept, things from the outside to come into that unit because it's so sterile and what have you. So that's a thing that we can tell our families and friends and our church members too.
Yes, and so and when actually what happens a lot, there are actually laundry rooms of course in the unit, and they'll make sure that things are washed prior to giving to the babies. But yes, blankets, hats, socks, baby clothes, those can all be gifted to the hospital.
All right, all right. Did you any other Sister Copper? Do you see any other questions that came in?
No, ma'am. And I just put a reminder out that those on social media can post their questions and we will ask. And I also put one in the chat. They can post their questions and we can get them answered. Thank you. Thank you.
Well, Dr. Bauer, I want to say that's all the time we have for now. We will continue answering questions during the extended Q&A period of this webinar today. Thank you so much for all that urgent information that is needed for us to look after our little babies and those families that are that they're struggling to what must I do and what did I do, and then letting them know that there is nothing that they did wrong. Thank you so much. October is also National Church Safety and Security Month. Many churches, especially in small towns and rural communities, lack safety and security measures. For unattended candles to unlocked entryways, even simple hazards can cause catastrophe if left unchecked. And in the light of recent acts of violence at places of worship, safeguarding our sanctuaries is a greater urgent than ever. If your church is vulnerable, now is the time to act. Each year, training guides and seminars equip congregations with tools to prepare for emergencies. Response plans and escape routes should be tailored to your building layout and your congregation's need. Start with a security check. 1, inspect candle placement and kitchen safely. 2, review exit and entry points. Number 3, identify areas accessible to trespassers. And number 4, evaluate risks in your surrounding communities. From there, develop a customized action plan. Remember, church safety is a team effort. Collaborating with trusted leaders and volunteers help us address concerns, set clear goals, and implement effective emergency strategies. Let's protect our place of worship with wisdom, vigilance, and care. Now it's time for an update from our Sisters Against Breast Cancer campaign. We are pleased again to welcome Lady Estelle Bryant, National Chair of Sisters Against Breast Cancer. As a reminder, Lady Bryant serves as the First Lady of Antioch Baptist Church in Liberty City, neighbor of Miami, Florida, where her husband, Dr. Jimmy Bryant, is senior pastor. Welcome, Lady Bryant. Got to turn you on mute.
Okay. Thank you, Sister Park. Good evening.
Good evening. Lady Bryant, we now begin the H.O.P.E Breast Cancer Awareness Campaign. What has been the response so far?
Sister Carr, just before I answer your question, I just want to reiterate that Sisters stands for Sisters in Step to Achieve success
All right.
against breast cancer.
All right.
And the answer to your question, the response has been great so far. We have churches across NBC USA who have embraced the toolkit. We've had dozens of downloads, and this simply means that our NBC USA churches are embracing the theme Sundays that we have in the toolkit. The prayer circles, the walk, the run events, and survivors are sharing their stories, and congregations are learning into they're leaning into education and early detection.
Okay. What are some specials by this coming Sunday?
What's so special about this Sunday is this Sunday, and this is still part of the toolkit. This Sunday is called Survivor Sunday, where breast cancer survivors would be recognized all over all of our states, and we will hear their stories. And as a breast cancer survivor myself, this is extra special for me to know that my fellow sister breast cancer survivors would be sharing powerful stories, their own powerful stories of challenge, but overcoming.
All right. Amen. Amen. And how should our churches be using the toolkit creatively?
Sister Carr, this toolkit has everything the churches need. And our sister church leader, now's the time for them to rally their volunteers if they have not already done so far. Follow the steps that's outlined in the H.O.P.E toolkit. And I'm already looking forward to seeing all of the photos from sisters, the walk, the run happening nationwide on Saturday, October the 25th. And each leader, all they have to do is they can go and register their state convention or their district association. They could actually just go Google NBC USA Hope. And once you click on that, you will go up to Sisters and click on it and follow those instructions in order to register. It is very simple. It's only 4 questions that's asked. It's about your association or your convention, the state that it's in. The information about yourself is your name, your email address, and a phone number. And it also asks a question about your attended participant, the minimum participants expected. And then you hit submit. And then after your walk, you must register by Tuesday, October the 14th.
Okay.
But after your walk, you can submit your sign-in sheet. You can send pictures. And that must be done by October 29th in order to be eligible. The highest number of participants for any walk will receive a $500 gift card.
All right now. All right now. That sounds amazing. That is amazing. All right. Is there any final encouragement for those watching? What would you encourage them to do, say? How can they participate even more?
Again, I encourage everyone tonight, as soon as this webinar is over, to go to NBC USA Hope and go to Sisters, download the toolkit. Once you register for the walk, you can download the toolkit, and it's very simple. And even if you did not start with us, we started September the 28th, the last Sunday in September was our kickoff. This first Sunday gone, we turned the church pink. This Sunday gone, our men did, the men who led devotion, they all had on pink ties. Our choir had on white with pink corsages. The entire the church was decorated in pink. So even if you haven't done that so far, it is still not too late to join us. And whether you will host an event or just wear pink, uh, your voice matter. Keep sharing, keep screening, keep standing in strength and spirit. And that's our national theme. Keep standing, still standing in strength and spirit. Stepping strong against breast cancer. And this campaign actually shows that health ministry is not a departure from faith. It's an extension of faith. Healing, justice, and wellness are gospel work.
All right then. Well, thank you, Sister Brian. Sister Brian will be available to answer additional questions during our Q&A period. Before we close, we want to share one national health wellness spotlight: diabetes awareness. Next month, NBC USA Hope will shine a light on diabetes, a condition impacting millions of families, especially in the Black and rural communities. Through education, prevention, and faith-based support, we're empowering churches to host a health screening, sharing nutrition tips, and encourage physical activities. Let's raise awareness, reduce risk, and walk alongside those managing diabetes with compassion and care. We invite everyone to join us in Nashville in December 1st to the 3rd, 2025 for the Sunday School Publishing Board Annual Educational Conference. Be sure to stop by our booth to learn more about the impactful work of NBC USA Hope team. Health Ambassador Training. To receive credit towards your NBC USA Hope Training Ambassador certification, 1. Email info@hopenbc.com to register, or 2. Request lesson training guide, and 3. Complete the training survey at hopenbc.com/training survey, including your email subject line NBC Hope Health Ambassador Training. Once again, our October health observances is National Church Safety and Security Month, NBC USA Sisters Against Breast Cancer, Pregnancy and Infant Loss Awareness Month. Let's continue to move forward in faith, health, and services. You may download the complete list of our annual health observances from our website, www.hopenbc.com. You will find additional information and resources on NBC USA Hope webpage at www.hopenbc.com. For more information, you can always email us at info@hopenbc.com. Wow, we have covered a lot this evening. Now the best part begins. It's time for our Q&A session. You may type your question in the chat or you can raise your hand virtually. For those watching on social media, Dr. Carper will be monitoring the NBC Hope Facebook comments, and we'll do our best to capture your questions. Are there any questions that's out there, Sister Carper?
Oh, ma'am, I was checking now. I see Sister Melvin joined us on social media. She did put her name there. So we want to recognize and thank her for being on social media. Sister, I'm thinking I'm pronouncing her name right. Melvin Wilson.
Melvin Wilson from Canaan Baptist Church, right? One of my members, one of our church members. Hey, Sister Wilson.
Yes, ma'am, she's on.
All right.
But no questions. We did have a question earlier.
Okay.
That I sent it to Dr. Browder. Did you see it, Doctor? Let me see what that regarding let's see, the miscarriages.
Yeah.
Okay.
I see it.
Yeah, so someone asked, I wonder, are more women having miscarriages, or are more people sharing their loss? And I care for sick preterm infants and babies with birth defects. And I'm not immediately privy to the miscarriage rate. But you know, that is an interesting point that you bring up, is how are miscarriages reported, and perhaps that the way that number was collected before versus now. Is it that miscarriages are more common because they're being reported more commonly? I think an OB-GYN would be better suited to answer that question. But it is an interesting point.
Okay. I have a question for Dr. Brower and Sister Estelle. Dr. Brower, are there any books, any resources we can offer to our moms, and especially dads, with the loss of a baby before birth and even after birth? Is there anything we can hand a person to read, to feel comfort during this time?
Yeah, that's a good question. I would encourage March of Dimes, not just the March of Dimes itself, but the March of Dimes to be a launching point to connect you to community, to other families who have experienced preterm births or whose babies are hospitalized, other parent groups, Facebook. There may be parent groups on Facebook of other families who are experiencing babies in the NICU or who have specific birth defects or specific conditions. That has been very helpful for a lot of my patient families, to just know that they're not alone in their experience. Community is very important, and one way to build community is through patient diagnosis groups.
Okay, all right. And Sister Estelle, with the number of
There is another question in the chat.
Go ahead.
I think that's for me. Are you seeing an increase in midwives and or advanced practice providers? And do you think they would help? Yes. So I work with midwives and with advanced practice providers, or like nurse practitioners or neonatal nurse practitioners. I know that there is data that shows that having programs like midwives and doula programs can help with maternal and infant outcomes. And yes, I work with neonatal nurse practitioners every day in my job. They're very important to the NICU and caring for these babies and families. So,
thank you. Sister Estelle.
Yes.
We know it's a stigma behind breast cancer. We know it's a stigma behind a woman losing her breast. How can a church rally behind that person, that woman? We know men also has breast cancer, but behind a woman, how can we rally behind? What can we do? Even when it's not the October, what do we do the other parts of the rest of the year?
Support the individual. We at our church, and we're not I wouldn't say that we're a mega church. We have 8 breast cancer survivors in our congregation, and we celebrate them at different times, not just during the month of October. And because we know who we are, we support each other, even when it's not in the month of October, and have an environment where you can open up and share text messages if you need to talk. And we have been celebrating breast cancer awareness at our church for years. It's ironic, I guess. It's divine intervention. I just got diagnosed in 2020, so I'm a 5-year survivor and had been the coordinator of breast cancer awareness at my church for years before that, talking to the ladies. And one of the things that we do, we monitor, not in, I would say, in a safe way. We monitor. One of the questions that we ask, how many women have had their mammogram?
Okay.
Raise your hand. How many women is scheduled to have a mammogram? Raise your hand. If you did not raise your hand in either group, please see me.
Okay.
And that's how I would say I found out. This is proud to even having breast cancer myself, being diagnosed with it. Someone saying that I've never had one because I'm afraid to. I've never had a mammogram because it's too expensive. I don't have insurance. So when we get that information, we're already looking for ways to get that person a free mammogram. We've actually had the mammogram bus at our church to serve the community for free mammograms. We just have been promoting it. And I think when you have that conversation, especially with Black women, it's almost like a hysterectomy. Your white counterpart will talk to you about it freely, but you may have someone else, Black, a friend of yours, you may not never know that they had it. So the same thing with mastectomies and other things. We've had oncologists, doctors at our church to speak and then show them breasts, let them feel what it actually feel like. We try to promote the monthly self-breast exam itself. And but I just think that having the conversation in an open, safe environment where they feel safe talking about it. And sometimes when you feel that the sister that's been sitting on that pew with you for the last 5-6 years had breast cancer, and now that you have it, you have someone that you can talk to. So at our church, you know, it's very open. Most members, if they have they feel something, they go to the doctor. They're going to come to that group of 8 of us, 1 of us, and they're going to have a conversation with us about it and say what they're going through. So I think that as a congregation, we need to not have it look like it's a stigma or anything. To open up, talk about it. And that's one of the things that we do at our walk. At the end of our walk, every year, all breast cancer survivors get a chance to, if they want to, tell their story, brief, and they help save someone else so they know. And I also just want to say to the newcomers with the toolkit, when you do your walk, and I still don't think it's too late, reach out to your local police department. If you're going to walk in your community, get them involved. You'll do all the work, and you're going to see how ours have been on with us for the last, since the pandemic. They have been walking with us because you do all the work. They show up, and then you send them pictures, and just get in touch with the major of that police department, and he will send police officers to walk with you.
All right. Great. I like that nugget. We have one more question for Dr. Brower before we go into our next section. Dr. Brower, there's a question that came up for you that you want to answer at this present time.
Yes, I saw the question. What are the most common causes of pregnancy and infant loss, and what steps can families and healthcare providers take to help prevent them? And I wanted to emphasize that we don't always know a direct cause for why a pregnancy is lost, or even why a baby is born preterm. But we understand risk factors that may increase the chances of preterm birth or pregnancy loss. And a lot of that has to do with mom's health condition, if she has any chronic health conditions, and if there are things that can be addressed, such as obesity or blood pressure, diabetes. If those chronic things can either be alleviated or treated properly, and that requires access to healthcare, even before pregnancy. And then during the pregnancy, it's important to have early and regular visits to the doctor for the routine screenings and care. So yeah.
Okay. Well, I want to thank you
Dr.
for your.
Carl, I'm
Sorry, go ahead.
I'm sorry. I saw one other question for me.
Sure, sure.
Do you encourage self-breast exams? Yes, I do. Because you know your breast
Definitely.
better than your OBGYN. You can feel things that you know that was not there last month. And even if you have dense breasts or fibrocystic breasts, you know how they felt last month.
Mhm.
Someone else may think it's something different, but you know your breast better than anyone. I do encourage self breast exams, and a lot of people talk about you forget one of the just a little tidbit. Use your birth date. If you was born on January the 8th, October the 8th of every month should be your date to do it. You don't forget your birthday. You would remember that date of the month. So yes, I do highly encourage self-breast exam.
All right. It's just a coincidence that both of these topics go hand in hand. Infant mortality, fetal,
Yes,
it all go hand in hand. Wow.
yes.
I want to thank you for everyone for their thoughtful questions and comments. We will take more questions at end of our meeting today, at the end of the session today. Our next TempleCare Matter webinar will be Tuesday, November 4th, 2025. Join us as we spotlight the key October observance and that uplift, educate, and empower our faith community. We'll talk about Pancreatic Cancer Awareness Month, honoring lives and raising awareness for early detection and support. We'll also talk about National Alzheimer's Disease Awareness Month and National Caregiver Month. Recognizing memory loss and faithful caregivers who walk alongside. We'll also touch on American Diabetes Month, promoting prevention, education, and compassion care in our churches. Another topic we'll talk about next month will be the Purple Light Sunday, which will be November 16th, a sacred moment to remember those affected by pancreatic cancer. And finally, we'll talk about the Great American Smokeout, what will be on November 20th, encouraging tobacco-free living and lung health through faith-based support. Let's come together to reflect and respond and renew our commitment to the whole person wellness. You may join us online and on social media. Our webpage is www.hopembc.com. Our Facebook page is National Baptist Convention USA Incorporated Hope Health Initiative. And you can also view us on YouTube. NBC USA Hope, H.O.P.E. We appreciate your feedback and would you kindly complete our webinar survey? We pasted in the link in the chat. NBC USA online webinar survey is https://hopembc.com/webinar-survey. We appreciate the tireless work of our NBC Hope team, Dr. Michael O'Miner, Dr. Desi Levy, Lottie Miner, Nettie Johnson, Pastor Dexter Morgan, Elaine McKnight Hill, Dr. Felicia Washington, Minister Geraldine Moore, Loretta Miller, Dr. Lavora Williams, Bettina Campbell, Dr. Marion Talley, yours truly, Ophelia Carr, and Thomas Dukes Robinson. Our 7 regional coordinators are Pastor Daniel Blackburn from the Northeast, Brooklyn Rogers from Southeast, Pastor Bernard Montgomery, Southwest 1, Dr. Linda Carper, Southwest 2, Teresa Ferris Farr, Midwest, Tafarashi Robinson, the West, Pastor Richmond Johnson, Far West. To connect with any of these regional coordinators, email info@hopembc.com. I'd like to thank you all for joining us this evening. We hope Some of you may have additional questions or comments. So we will formally close tonight TempleCare Matters webinar in just a moment. For those of you joining us via Zoom, we'll open the mic shortly for additional session feedback. We'll see you again on Tuesday, November 4th, 2025, 7:30 Central Time for our next TempleCare Matters webinar. But before we close, we want to spotlight our president, Dr. Boise Kimber, who reminds us we are changing the course, not our convention. The gospel still works. Thank you.